we started the Ambassadors Programme, almost 2 years ago. And one of those people was a chap up in Liverpool who, over these past, 20 months, has been incredibly inspirational. And moving forward, I hope he's able to inspire other ambassadors to come through to aspire to be as successful as he's been. It's a pleasure to welcome Andrew Bishop to the stage.
As you can see, I'm here to talk about my experience as an ambassador, as a volunteer for PHC, and I'll tell you a little bit about my experience with type 2 diabetes. So, I have a small disclaimer. Obviously, I'm not medically trained. I am by trade a computer network engineer and designer, so I install computer networks for a living. So when I go out and speak to people, other GPs, patients, and so on, I like to make them aware that I am obviously not medically trained at all. So for me, it started in the 1980s, and I was at college. I was studying electronics, and I found computers, and ultimately that became my career. And working in an office and working on computers is quite a sedentary lifestyle. And as time goes on, you can see I had an inversely proportional relationship with the technology that I was using. So much so that by 2015, I reached 15.5 stone. My BMI was just under 31 at the time. So I put that down to just being married, kids, life, getting older, and I was starting not to feel so great. Things were taking me longer to do. I felt sluggish. I felt tired. I had some problems with the joint in my right knee, and again, put it down just simply to age and getting older. Typical bloke, didn't really bother with the doctor much, you know, thought, oh yeah, well, it's only minor stuff, you know, everyone gets this, why should I go and bother the doctors, they're busy. But things did start to come to a head. So in 2016, I thought, new year, new me, I'm going to follow this Eat Well guide, and I'm going to get fit, I'm going to join the gym, I'm going to lose some weight. And that is an example of sort of typical kind of things I was eating. You know, so we've got up there, we've got some still orange with no added sugar, which was great. Low-fat yogurts, you know, and I thought I was following that pretty well. I did squeeze in the odd Kit Kat or chocolate digestive, but that's what I see typical sort of office workers' lunch that's going on there. So I joined a gym as well, and used to drag myself to the gym 2 or 3 times a week, and I started seeing some results. I was 15.5 stone, and I got down to just over 14, but still wasn't feeling great. A couple of months later, the weight starts creeping back on again, even though I'm not going to the gym as frequently, life gets in the way, all that sort of stuff. So I went to my GP, who was really surprised to see me because she hadn't seen me for 10 years or so. And she said, oh, while you're here, we'll check your blood pressure. I said, right, okay, off you go. Oh, that's a bit high. Come back and see the practice nurse in a week's time and get your blood pressure checked again, which I did. And I got exactly the same sort of response from the practice nurse. Oh, that's a bit high. I think we better send you for a blood test. I said, rightio, so I'll go for this blood test. And I come back and I get told that my HbA1c is 62. Up until then, I was blissfully ignorant about what HbA1c was, and that number, 62, was a number. And she explained that I had now become a type 2 diabetic. I said, right, okay, obviously I'd heard of that, didn't really have much experience about it. And so I had a conversation with her, and I said, right, what does that mean? What does it mean to me? What's going to happen? Well, here's a prescription. You're going to get the holy trinity of tablets. So I was given 2 metformin, statin, and ramipril. And we're going to keep checking you and checking your bloods and check your feet, and we'll send you for eye tests, and you can speak to a dietitian if you want as well. So I was just, like most patients, I'm a rabbit in the headlights. I'm sitting there, all these numbers are coming at me, all this information. I've got this booklet, and I go, oh, thanks very much, and off I pop. And I'm driving home and I'm thinking, I've got to explain this to my family, to my wife and the girls and so on. And we all sort of thought, I think, what a lot of people think is, I've got diabetes, but the doctor's given me some tablets. So I'm going to be okay because I've got tablets. I suddenly remembered watching this. And this was sort of the start of Jamie Oliver's sugar campaign, Sugar Rush. And he was in hospitals and talking about diabetic amputation. And I recently came across this. Scary numbers of diabetic amputation. And that really, really shook me. And I thought, hang on a minute, this can happen to me. I don't want this happening to me. I quite like my feet. I'm rather attached to them, and I'd like to stay that way. So, for me, I had a bit of a surprise when I started Googling things, and it says it's a chronic progressive disease. It leads to heart attack, stroke. The doctor or nurse didn't say that to me. I found that on the internet. But that's the conventional wisdom. A month later, I saw this. So, hands up, anyone who's seen this documentary. Oh, wow, that's a better response than I normally get. That's quite good. So a month after being diagnosed, I saw that and I thought, wow, because here's this guy and he's sort of semi-retired. He was in the profession that I was in. He was an engineer for BT, and they were concerned about his feet and talking about removing toes or his foot. And this was all turned around by moving more and by eating better, by eating real food. And I thought, well, there's got to be something in that. You know, it's been on the BBC. It's a proper documentary. That's really, really interesting. So that piqued my interest. So I did what every GP loves the patient to do. I went and hit the internet and looked up type 2 diabetes, how to get rid of it, all that sort of good stuff. And I'm really glad I did that. And like I say, I do this for a living, so internet to me is second nature. I came across these guys. I thought, oh, wow, they're interesting, especially that Mike Mosley fella. I like him. He experiments on himself. I've seen that a few times. He's quite a character. And I came across all these and I thought, wow, that's really interesting. And then I came across this guy. I thought, oh, he's a cardiologist and he's talking about fat. That's definitely interesting. He was on Sky News, and I thought, right, well, this guy comes across as a bit of a rebel. I quite like him, actually. He's interesting. So I parted with me 20 quid, and I downloaded that, because he was talking about the big fat fix at the time. So that was the second film that I saw that had an impact on my decisions going forward. I started looking for a proper GP, you know, one who works for a living, isn't on the internet or on telly, and I came across these two. And I thought, well, I'm sort of, where I live, I'm sort of in the middle of the two of them. And I was on Twitter, and it was Joanne I saw first, and Joanne and Keith, who's a patron from PHC, who's here somewhere in the audience, were starting a low-carb group in Warrington. Now, I'm not a patient of Joanne's, but I work in Warrington, and being a cheeky Scouser, I thought, well, what if I get in touch with them? Can I come along and have a look at this low-carb group he's starting? And they said yes. I thought, great. So I went along, and I met Joanne, and I met Keith, and part of the conversation we had was around blood sugar and monitoring your blood glucose. So I went and bought a meter, and I started testing, and I thought, right, what can I start with? I thought, breakfast, that's a good one. And so for me, and in my world, I deal in root cause analysis and proof of concept. So I began my own little proof of concept experiments. So on the top there, that is grain-free granola, and that's from a recipe from ditchthecarbs.com, run by the marvellous Libby, who's a pharmacist in New Zealand, and then Weetabix. Now, I used to eat Weetabix. I didn't eat it like that, though. I had raisins on. I even had David's favourite on, chopped up banana, on top of the Weetabix. And they're my blood glucose readings there. In fact, when I first did this, I just did before and 2 hours after. And this GP on Twitter said, yeah, but, you know, I don't think that's long enough. You need to do it longer. So I said, right, OK, I'll do it again. So I did it for all that time. And what that looks like on a pretty graph, I'll come to in a minute. But the reason I picked Weetabix, and Hugh is not going to like this, these damn traffic lights here are all green. Every single one of them. Every one of them is green. That's what it does to my blood glucose. So for me, that was it. I thought, right, there's definitely something in this. I'm going to do more testing. And I would randomly test meals that I ate. And I eventually became more and more low carb, more real food, more cooking from scratch. I also bought a Fitbit. Now, I know these are quite controversial, not a lot of people like them, but for me, it's a good motivator because I started walking. At the time, I'd just finished a set of exams because I have to recertify every 3 years, and I was getting up really early, so I thought, right, instead of getting up and doing half an hour studying, I'll go for a walk for half an hour. So I did that, and then at the weekends, I started extending that time, and pretty soon, it appears I've walked the length of India, which was quite an interesting little fact. And that's my graph. So what was interesting for me, my GP, really loved my GP, she printed this off for me. There I am at the start, there I am 3 months later, 39. It took me 3 months. Just walking around the block, walking a bit more at the weekend, and eating real food. So I was chuffed with that because I knew that was a non-diabetic number. So I'm there in front of the practice nurse, and she gets the results, and she looks at it, and she's looking at me, and she's looking at the screen, and I'm grinning. I'm thinking, sorted. And she said, yeah, what have you been doing? So I explained to her, and she went, yeah, you'll never keep that up. You'll never keep that up. And I said, well, hang on a minute, that's in the normal range. Why can't I come off my tablets? Now, you're on them for life, that's it. You're on them for life. She did come to a compromise. Instead of taking 2 metformin, I got cut down to 1, and I was still on the ramipril and the statin. So I went back for other blood tests as I went along, and as you can see, it's sort of leveling out about mid-30s. December 2017, they got a new practice nurse. So I went to see her instead. And I had a conversation with her, and I was really thrilled that when I walked into her office, on her desk was a copy of the Carbs and Cals book. And I thought, ooh, this could be an interesting conversation. So I mentioned this to her, and she goes, yeah, she goes, that's really good. She said, but look, I'm new here. I can't really rock the boat. And I said, well, who do you need to speak to? Because I'd seen a locum in the practice who said to me, what are you taking them tablets for? So she said, leave it with me. I'll give you a ring in the afternoon. And she rang me back about 3 o'clock that afternoon and said, yeah, I've checked with the senior partners and GPs, and yeah, stop taking the metformin and the statin. So I was absolutely thrilled with that. So, as David was talking about yesterday, n=1. So when I go out and I'm talking about this, I get this a lot, you know. So I'm very proud to be a black swan. And I'm even prouder that I found where a lot of them are. If you go here, so the marvellousdiabetes.co.uk have a fantastic forum, and it's full of people like me who've either been recently diagnosed or have been doing this for a while. It's a really supportive community, and they've got thousands of n=1s there. So, you know, I strongly recommend anyone to go and have a look at this. So that leads me to public health collaboration. So when I met with Joanne and Keith, they said they were members of PHC, and I was like, oh, right, okay, well, what's that? And they explained. I thought, oh, that's good. But I'd had such good results, I decided I needed to give something back. So I went onto the website and had a look, and there's a section there, do you want to volunteer? I thought, yeah, that'll do me. So I put my details in, signed up as a volunteer, didn't hear anything for months, absolutely months. Didn't know what I was volunteering for or anything. No, and all of a sudden, Sam got in touch with me and said, we're having a conference and we're looking for people to volunteer. Do you fancy coming along? And I said, yeah. He said, we'll do a little phone interview and we'll see how you go. And we did that. And I volunteered at my first conference, which was in Manchester 3 years ago. So that was the start of my relationship with PHC. Earlier this year, before I get to that, sorry, the reason I joined is because of this. This is all fantastic stuff, and it's really easy to understand. And for me, with my engineering brain as well, they do these randomized control trials. They were proving what they said this stuff was doing, that by eating real food, it can have significant impact on your health. So earlier this year, I saw this chap again. Now, I've seen him a few times at the conferences, and I found out, oh, look, we've got PHC Australia. That's really interesting. And as you all know, I'm sure, Peter has worked with some successful teams in the past, some football club called Liverpool or something, and a bunch of guys who like to play cricket. And And rumour has it that Peter is now developing a superstar team of ambassadors in Australia. So I'll be quite interested in that. But Peter, if you need an experienced PHC ambassador to come out to Australia, have a word with me later and we'll sort something out. So, as I said, I've joined the ambassador program, and this is what ambassadors are all about. Yeah, and we've got quite a few. It's growing in number every day. I've had a few people at the conference come up to me and say, "Oh, how do I become an ambassador?" So I explain it and point them at Sam. And this is difficult. This isn't easy because getting your foot in the door in a GP practice is really, really difficult. Most of them are shockingly busy, and I got to do it by joining the PPG in my local practice. And I went to the first meeting and I suddenly realized, how do you even have time to see patients? They are incredibly busy with lots of other things going on. And what started it for me was at that meeting, they said, we're looking for people to talk at the PPG. I was like, yeah, I'll do that. And yeah, I said, well, I can talk. I'm a type 2 patient here. And by the way, I volunteer for an organization called PHC. I'll tell you a little bit about them as well. So I went along and thinking, yeah, the next meeting, that's me. I'm going to be talking there. No, it took just over 6 months for my turn to come. So you've got to be really patient if you're an ambassador. And that turn did come, and I gave a presentation, something similar to this one. And I was allowed 15 minutes. Just under an hour later, we finished. There were a lot of questions. And the senior partner GP said, thanks very much, Andy, got up and left. And I thought, I was hoping for a little bit more than that. You know, I wanted a conversation. You know, let's get this ball rolling. 2 days later, I received a letter from her. And to sum the letter up, it said, Dear Andy, thanks very much for the presentation at PPG. Absolutely amazing. I was really impressed to see a patient taking charge of their health and making such a difference. How can we do this in our practice? So that was my foot in the door. So that's where I ran my first low-carb group with the patients. And I was a bit nervous about doing that. And I said, I'm quite happy to do this, and I'll go through. And I've got this little 8-week program, and I've pinched some amazing ideas from Dave and Jen and Joanne and Expert Health, and I sort of put them all together in my particular style. I said, I want a clinician in the room because I'm not medically trained. And there's going to be people there who have other complications or are on other medication. I'd feel a lot more comfortable with a clinician in the room. And so the 2 partner GPs took turns in sitting in, and the 2 practice nurses took turns in sitting in. And that was interesting. And I'm not having a pop at practice nurses at all, but I did a week where I talk about fat and healthy fats, and they sat there like this. Not happy. And so I went to see the GPs afterwards and showed them and explained what it was. And they said, Andy, that's fine. Don't worry about it. They're driven by their guidelines and NICE and regulations, and totally get that. So halfway through my 8-week program, Dr. Allen asked to see me, and I thought, oh, God, I'm in trouble. And she's the senior partner there in the practice, and she said, Andy, we're going to stop coming to your meetings. Not because of anything you've said or done, just because we think us being there is actually putting the patients off from asking questions and behaving in a more natural way. We're confident you're not going to do anything stupid or silly. Carry on. So I did, and I asked for feedback at the end of that as well. So I had a meeting with the practice manager and with Dr. Allen, and the feedback from the patients was excellent. They absolutely loved it, couldn't get enough of it. So much so, the practice has made some changes. They now include low carb as a standard offering in the practice. And on top of that, they have said that one of the practice nurses will become the low carb champion for the practice. They asked me for something as well, which was fair enough. And they said, any chance you can get a clinician from PHC to come in? Because we've got a training day every Thursday. Once a month. And I said, well, I can ask. You know. So I went and spoke to Sam and said, yeah. He said, and Joanne was busy. Unfortunately, she couldn't do it. But I was really, really thrilled. And I just want to say thanks again, because Dave Unwin came to my practice and spoke to them about low carb. as a result of that, they've all got these little infographic cards stuck to their computers.
Nobody escapes, mate.
which was fantastic. I mean, marvellous results. So, being an ambassador, I've got to meet some really, really interesting people. I think I'm really lucky. Now, this chap, John Joyce, he's not an ambassador. He knows about PHC, he gets it. But he does something similar in his practice up in Blackpool. He's a patient. His wife has MS. He was pre-diabetic, and he's a big advocate of real food. And John works as a project manager for Blackpool Council. He looks after Blackpool Illumination, so he's a busy chap. But he goes into his practice, and he has a group of people there, and the practice nurse there is a tremendous low-carb fan. And he'll come in and he'll say to people, right, OK, what did you eat for your dinner? And they'll say this, and he goes, right. And he's got a whiteboard behind him. Let's see how we can make that better with real food. And he'll go through all these stages, and absolutely brilliant. His food is amazing. Please check out his website. And for anyone coming to Real Food Rocks, he's going to be there cooking. Yeah, cooking live. The Three Amigos, John's one of them, and it'd be a treat to see him again. Someone else I met is Emma Porter. And as Dr. Lake, I think it was, said earlier, Emma's got this great cookbook out. I really like this book because I cook a lot of stuff in this and take it into my low-carb groups. I always take something in for them to try. So I take that in, and then I take the recipe in as well, so they can go and make it at home afterwards. And that was an idea that I pinched from Jen when I went up to spend some time with David and Jen on their groups. And it's a really big success. And I keep tweeting this, to Emma, and we ended up having a conversation over email and so on. I said, look, one of my low-carb groups is coming to its end of its 8-week period. It'd be fantastic if you could come up and give a bit of a talk. I said, because you're a type 1 as well, and you've got this cookbook, and you're a great cook and all this. And she said, yeah, and I charge so much per hour for my talks. And I thought, oh, that's it. And the travel cost, and I thought. So I emailed Faisal, who was the GP I was working with at the time. He went, not a problem, Andy, we'll take care of that. Just get her up here. And she's recently come up to the group, and that's a picture from the evening, and gave a fantastic talk and brought some wonderful samples of her food up as well. So it was great to meet Emma there as well. And I've also met someone else, this chap. Now, here's a guy I never thought I would meet. He was here at the conference last year. He gave an incredibly emotional speech, and he's one of the nicest human beings I've ever met. Really, really great guy. So I never thought I'd get to meet Tim next. So at last year's conference as well, there was also talk of this fantastic little module. And so every time I go into a GP and I talk to the GP and the nurses, I say, have you done this yet? It's free, have a go, and you'll get a start at this. This'll pique your interest. And so out of curiosity, who's done this? Oh, look at this, that's great, yeah. Still plenty of you, got loads of opportunity, just go to the website and give it a go. And last year as well, there was these two characters up here talking. And this, for me, was the really surprising talk at a conference, because I knew about parkrun, of course, I've heard of it, and I was just procrastinating, thinking, yeah, I'll get round to doing that one day. And, I can't run. I couldn't run to save my life. I can't. 5K, that's like, in proper money, that's about 3 miles. That's quite a distance. But what I did do, after listening to these two guys talk, was go and join my local parkrun. So this is the parkrun team here. These are all the volunteers at Knowsley Parkrun, where I run. This is Eileen, who walks the course every week. And these two are volunteer marshals. Now, this was taken, Patrick here, it was a horrendous day, absolutely chucking it down, really awful day to be out and running, and he'd just turned 83. And there he was, on the corner, just as you turn round by the lake, doing his volunteering. They're there week in, week out. Amazing. So this is me, getting jiggy with parkrun. So the first time I did parkrun, I walked around, and as you can see there, 51 minutes. That's my recent attempt to walk, crawl, and jog round at 36 minutes, so I don't think Mo Farah's got anything to worry about just yet. But a decision I did make was that I will volunteer 1 in 4 of my park runs because I think that's really, really important to do. And it's not just about the exercise and running. You know, you're out there in the fresh air, and the people and the volunteers there are amazing. Absolutely amazing. It's a great social event as well. People are really friendly, and I'm completely shameless because, as you can see, I've got a PHC t-shirt on, and I always make sure I'm wearing that when I do a park run, one of them. So this is my new one for next week's park run. And it's a great conversation starter, that as well, because I've run this course with nurses and doctors who've turned up, and, you know, I guess, oh, you're a nurse? Oh, great, thanks, nurse, you're a GP. Oh, that's fantastic. Have you ever heard of PHC? Let me tell you, and I bore them while I'm doing the park run going around, so that it's a captive audience. So I really enjoy it. I really do enjoy that. So much so, it's given me the confidence to do other things. So this was me doing Santa Dash, and recently I've just done a run to raise some funds for Stroke Association as well. Now, I wouldn't have been able to do them just over a year ago. So I'm really chuffed that I can do that kind of thing. So on to my work as an ambassador. So these are the 2 practices that I've done the most work for. I have spoken at a couple of GP networks and other things. And this is the flyer that Dr. Masarani's group do for the Low Carb Life program that we run there. So there you go, there's me in action. So there's the group. This is the most recent group in Knowsley in Faisal's practice. And this is me talking to a GP network and some very familiar looking sort of handouts that get given to everyone, along with a PHC contact card, everyone I meet. So. And through Faisal, he has a charity called Care Merseyside. Now, Care Merseyside were created to promote social prescribing. So I do a lot of work with them now, and it's all around the low carb training that we offer in workshops, and that's Kathy, who's the chief exec of Care Merseyside. And that's been a really great thing to do, so much so that Kathy knows another charity called Imagine If, and I've had an email from the CEO of Imagine If, and went to meet him and 2 GPs on Wednesday, and we're going to be starting a low-carb group in their community centre in September. So word is getting out there and things seem to be happening. So when I run these low-carb groups, as I say, I think it's really important to take some samples in, give people recipes and so on. But this is it. I run them for 8 weeks. We're going to change that to 12 weeks so we can get a decent set of biomarkers at the start and at the end. And, you know, that's going to benefit the GPs who are supporting this. And this last group have been absolutely brilliant. Such a bunch of characters. They're amazing. So outside of that 1 hour slot I do each week, we have a closed Facebook group and we have a closed WhatsApp group. And the WhatsApp group goes absolutely mental. You know, I get pictures of what they're cooking. There's loads of interesting questions getting asked, but they're starting to interact with each other. Not just asking me questions, you know. All the people in this group, and there's about 25 people in that group, are all chatting to each other. They never knew each other before they came here. So it's building relationships between these people. So as a result of that, they decided to do a little video. If we can show the video now, please. My name's Andy Bishop, and I've been running a low-carb and real food lifestyle course for the last 8 weeks. I work as one of the Liverpool ambassadors for Public Health Collaboration. They're a charity who promote this real food lifestyle, and part of my role as an ambassador is to work and develop networks with GPs, nurses and so on to promote this way of living. So reducing your sugar, reducing processed carbohydrate, and the impact that's going to have on your overall health, weight and well-being. I was diagnosed as a type 2 diabetic, and I pretty soon found some sources that said, well, if you start reducing the amount of processed carbohydrate you eat and you move a bit more, it could help with this diabetes thing. And that's exactly what I did. So in 3 months, my bloods went from 62 down to 39. Now 39 is classed in the normal range, and I'm not saying that it's cured my type 2 diabetes, but it's certainly enabled me to keep my diabetes in remission for the last 3 years. about 20 to 25 each week. It's a 1 hour session. The current version of this runs for 8 weeks, and it's introducing people into the idea of what low carb and real food is all about, showing them how this food can be really tasty and not boring or bland, trying to make it as easy as possible to understand some of the science behind it, and also getting people to realise how important those numbers are that the doctors and nurses quote to you when you get your blood test done.
I joined to try to reverse my diabetes. I've gone a long way to doing that. Hopefully I'll still achieve that goal. I've lost weight, I feel better, and I've been introduced to foods I didn't know exist. It's been excellent. I've lost 1 stone and 2 pounds. I actually lost that in the first 3 weeks. HbA1c has gone from 94 to 71, and medication wise I was taking 32 units of insulin. That's now down to 14. Again, probably over a period of about maybe 4 weeks of the 8 weeks. I spoke to my doctor, several doctors, and the diabetic nurse, and they all recommended I drop the dosage insulin down to that amount. So far so good. Hopefully we can get it down even further.
I've been coming to this group for support for my husband, who is a type 2 diabetic. This group has taught me a whole load of stuff. It's been amazing. The support from the group has been fab, and I'm still working on my husband. I've actually lost weight since I've been on it, and the thing is, it's just about looking after your own health, keeping yourself well, and making them small changes to make a big difference.
The community aspect of this, bringing everyone together, enables people to share common experience. So we're building relationships with people who've never met each other. They're becoming more confident about their cooking and experiences. They're talking more openly about this. Not only do we run the 1 hour sessions, we also have a closed WhatsApp group and a Facebook group. So there's a lot of chatter between people there, and we can see people are, making new friendships and becoming more confident. And so there's a lot of other benefits than just the medical side of it.
I'm Brenda O'Toole, and I've been part of the low carb. It's 5 years since my husband died, and he loved his food, but he had proper meals. But since he died, I've had rubbish. Out of packets, pasties, pies, wedges, you name it. And I felt rotten, horrible. But since I've been this, wow, I've lost nearly a stone. I can move better. I just feel younger inside, and it's made it easier because when my husband died it was so hard, and it's not just the grief, it's the not bothering, but I'm bothering again, and it's great. I'm just so happy with myself.
I'd suggest that people give low carb a go, especially if you're a type 2 diabetic, because unfortunately it's still classed as a chronic progressive disease that is only going to get worse and takes its time. Your medication is more likely to go up, and by adopting a low carb lifestyle you've got a chance of reducing your meds, if not coming off the medication altogether. So it'll help you look better, feel better, live longer. When I'm running these groups, some of the questions and comments I get all the time are, look what the newspapers are saying. 1 week this is good for you, the next week it's bad for you, statins are great, statins are the devil, fat is good, fat is bad. People get really confused easily, and the media is not helping this situation. This makes people feel like Neo from the Matrix. They're sitting there and they're given a choice. Do I take the red pill or do I take the blue pill? Personally, I'd recommend real food. So, when I'm talking, I operate on a principle that I call C. Sustainable. This has got to be sustainable. This is your life going forward. It's a lifestyle. It's not a diet. It's not a fad. It's not a quick fix. It has to be sustainable. It's got to be easy. If it's not easy, people aren't going to bother. You know, we all lead busy lives. We come home from work, you know, and it's really got to be simple. You've got to make this as easy as possible for people. Enjoyable. If it's not enjoyable, why would you bother? Yeah, the food has got to be tasty. It's got to, you know, it's really, really important. And the thing I like about this is, we're not counting colours or points or deciding food's a sin or all that sort of rubbish. This is just about real food, cooking your food from scratch as much as possible. So a shameless plug for Real Food Rocks. Conferences are great, and conferences tend to be for professionals, and festivals are for families. So I'm hoping as many people here can come along to this. It's going to be a fantastic day. And I'll finish on a slide I always finish with each of my groups. And it's a neat little summary about what this lifestyle is all about. It's your choice. It's going to give people hope. You do have to move more, but you don't have to join a gym. You don't even, if you're not a runner, don't run. Come along to parkrun and volunteer or walk around it. Just get out in the garden, go and play with the kids, that kind of thing. And hopefully it will lead to improving your health. Thank you very much.